Hi, my name is Dr. Bob Foltz. I'm going to take a couple minutes today to explain why the VitalChild system places importance on understanding the experiences and impact of trauma exposure in the children and adolescents within your system. I'm an associate professor of clinical psychology, but I've got many years of experience working in the field. I'm also a member of the VitalChild team. Now, what we know is that trauma exposure can lead to significant physical health problems. It leads to emotional and behavioral problems. It can negatively impact learning. It can lead to substance abuse. It can even shorten life expectancy. It can diminish interpersonal happiness. But what we also know is that trauma exposure can be effectively treated. Now, as seen here, the number of traumas that are experienced can increase the impairment that is experienced by the children and adolescents. So across attachment problems, behavior problems, even criminal activity. More specifically, self-injurious behaviors and suicidality, running away, and substance use all significantly increase as the number of traumas increase. Now, impulsivity, verbal, physical aggression, dysregulated emotions, disrupted relationships, concentration difficulties, perceptual distortions, even auditory hallucinations are all symptoms of trauma. But they also could be characterized or diagnosed as pediatric bipolar disorder, disruptive mood dysregulation disorder, anxiety, depression, ADHD, conduct disorder, and even psychosis. When the emphasis is placed on the disorder rather than understanding it as trauma, the prominent treatment intervention tends to be medications. These medications could include antipsychotics, antidepressants, mood stabilizers, stimulants, or other therapies that may not result in optimal outcomes. The result of that is an increased length of stay within the system and a poor use of your resources. So let's be clear. A good assessment leads to a diagnosis or a clinical conceptualization. That diagnosis leads to treatments, and those treatments lead to outcomes. But understanding those symptoms as trauma is a critical piece of understanding the full picture of the child. That's why VitalChild has introduced and integrated a trauma assessment that's developmentally informed. It measures the trauma exposure, but it also measures the intensity of that exposure. It measures across 20 categories, and it's consistent with forthcoming legislation. Now, all of this enhances your evaluation, it clarifies the diagnosis, it automatically integrates into treatment planning, and it has real-time reporting capabilities. Overall, this drives an evidence-based intervention strategy. Make a measurable difference. Call VitalChild today to schedule your demonstration.